RNA-seq identifies patients at high risk of progression in non-complete pathologic responders from the NADIM study. Dr. Casarubios comes to us from Oncologia Medica in Madrid in Spain. She is a passionate scientist with extensive experience in immuno-oncology research. Thank you.
Hi, thank you very much for the nice presentation, and thank you all for this opportunity to show our results. I'm here on behalf of the Spanish Lung Cancer Group. So I'm going to present just a briefing of some highlights of our study in patients from the NADIM clinical trial. These are my disclosures. As you may know, non-small cell lung cancer patients with locally advanced disease had lower overall survival. So in this context, our group initiated some years ago the NADIM clinical trial in which patients with resectable stage 3A were treated with 3 cycles of anti-PD-1 nivolumab and plus chemotherapy prior to surgery. So these results were published in 2020 in Lancet Oncology, and we have shown that patients treated with this neoadjuvant chemoimmunotherapy scheme achieve a progression-free survival and overall survival rates at 2 years of almost 77% and 90% respectively, and also up to 63% of patients achieve a complete pathological response. That is no evidence of tumor at the time of the surgery. But also, these are encouraging results. Patients with non-complete pathological response, non-severe patients, had a higher risk of disease progression compared to complete pathological response. So there is a need to identify gene expression patterns that may affect the long-term outcomes in this high-risk group. So here, our study is focusing on post-treatment tumor samples of NADIM clinical trial patients. The samples of these NADIM clinical trial patients were also categorized as CPR and non-CPR. CPR if they have no viable cells in the tumor specimen, and non-CPR tumors that have any number of viable tumor cells on the tumor specimen. So first, we wanted to characterize the differential immune landscape between the 2 groups, the CPR and non-CPR tumors, as well as to identify gene expression patterns that may affect the long-term outcomes of patients with non-CPR tumors. And by comparing tumors of patients that has disease progression and no disease progression. So for this purpose, we perform a RNA sequencing analysis of 395 immune-related genes. And we analyze the differential expressed genes between the 2 groups, the CPR and non-CPR groups, and the groups disease progression and non-disease progression. Also, the differentially expressed molecular pathways and the differential immune cell population estimation in these tumor samples. So first, briefly, regarding the differential immune landscape between CPR and non-CPR tumors, we show that up to 22 genes were upregulated in the non-CPR group. Most of them were related to proliferation, tumor markers, among others, and the further GSEA analysis showed an upregulation of pathways that were related to antigen processing, TCR co-expression, and also lymphocyte infiltrate. On the contrary, patients with non-CPR tumors showed an upregulation of proliferation, tumor markers, and tumor antigens, that it was consistent with the presence of viable cells in the tumor resection specimens. On the other hand, in the identification of patients at higher risk of relapse and the comparison between the progressive and non-progressive patients, patients with these non-CPR tumors were further categorized as progressors or not progressors, depending on whether they have disease progression or not. So we wanted to identify some. We wanted to identify an immune expression pattern that can help us to identify patients at high risk of relapse after surgery. So in this concern, we have shown that up to 10 genes were identified and differentially upregulated in patients with disease progression. Some were identified, well, some were involved in the type 1 interferon signaling and interferon type 2 signaling. But there were no differential express pathways or immune cell subtypes observed when comparing these two groups. We also perform a survival analysis in these patients with non-severe tumors that progress and not progressed after the therapy, and we show that there is a relationship between higher levels of AKT1 in post-treatment tumor samples of patients that was correlated with higher risk of progression and death. And also, no difference were observed between progressor and non-progressive patients in estimated cell proportion. Higher proportion of neutrophils in patients with non-CPR were associated with lower PFS and OS, or so worse outcomes. So to conclude, our results reinforce the differences between CPR and non-CPR response and support that neoadjuvant chemoimmunotherapy enables some proficient anti-tumoral immune response. Also, we have identified an immune expression signature in surgical specimens that were associated to disease progression in patients with non-CPR tumors, which could help in the follow-up and therapeutic management of this high-risk group. And these are all the people that contributed to this work. And well, the talk is today at midday, I think, and in the Hall C7. So hope you to see there. Thank you.